The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, you and I have the time to discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come into my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it's too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Today's topic is going to be on medical marijuana. My goal today is to remove the stigma associated with medical cannabis. I prefer to call it medical cannabis. Before we discuss medical cannabis or medical marijuana, let's discuss recreational, because that's on everyone's mind. As you know, there are certain states in the country that have recreational as well as medicinal. Here in New York, we're medicinal. We did pass, Governor Cuomo did pass recreational. There is two parts to the law. The first part is implemented, and that is the legal aspect. So if you have some little marijuana in your pocket for personal use, you're not going to be arrested. You won't be given a fine. If you are in the pipeline to see a judge for weed-related issues, okay, for selling or distributing or just carrying, that particular charge will be dismissed. Also, if you have a history of a weed-related charge, that charge will be expunged. The second half is the actual purchasing and for individuals to open up dispensaries. This month, New York State is completing its challenge phase. And the challenge phase was for a year where the community can challenge this particular law, and especially the second half, which I'm describing now. So within the end of this month, the medical board upstate New York that covers and oversees, or what we call governs, the medical marijuana, the program itself, they'll sit down, they'll look at the challenges, and they'll figure out a way to improve the program. And once they have a vote, New York State will draft rules and regulations, and then this program, the second half, and the recreational marijuana will be implemented in its entirety. How long? It could be anywhere from 6 months to a year, or even as short as 3 months. I'm not sure. It all depends on the challenges and how New York State's going to handle it. Okay, so let's continue. Medicinal or medical marijuana. So my goal is to make my patients comfortable and functional. Okay, this is not recreational, so my patients are not walking around like. Think of Sean Penn, the character he played in Fast Times at Ridgemont High, Spicoli, that's California surfer, that stoner dude. Hey, man, with the slurred speech and where's my pizza? And then falling asleep. And that's all. That's a side effect of THC, which I will describe. So, with medical marijuana, you just heard my goal, and that was my mission. In New York State, I am considered the pioneer. That's right, the pioneer. I'm one of the first to get certified and be able to prescribe medical marijuana. I am the first to open up a medical office in New York City. The first. I certified over 1,300 individuals that meet the requirements so they could be treated with medical marijuana or medical cannabis. 3 years ago, this past February, I published my first book, which is my first certified #1 Amazon bestseller, and it is on medical marijuana. So if you go to Amazon and you go into the search bar and you type in Dr. Thomas G. O'Brien II, you'll see my 2 books. The first one is exclusively on medical marijuana and the benefits of. I also have case studies where I discuss my patients. My patients are protected. I make sure they are protected under HIPAA, so I have written permission, And then my second book, which was a follow-up but also an extension, so I included more material, case presentations, as well as I introduced myself and osteopathic manipulative medicine. So let's discuss medical marijuana. Marijuana itself has been around thousands and thousands of years. This is nothing new. It's been around thousands of years. In the body, we have what's called the endocannabinoid system. That means the body naturally has receptors for cannabinoids. And marijuana has cannabinoids. There are 113 cannabinoids in the plant. The plant itself has a total of 400 chemicals. So out of the 400 chemicals, we're dealing with 70 cannabinoids that have the medicinal properties. The 2 chemicals that we focus on and their derivatives are THC, tetrahydrocannabinol, and CBD, cannabidiol. Structurally, these 2 chemicals look identical. However, CBD is lacking 1 bond, and since it's lacking 1 bond, it will have a different characteristic. Since it has a different characteristic, there will be different receptors. Since there's different receptors, it's going to affect different parts of the body. So THC has CB1 receptors, cannabinoid 1 receptors, and those receptors are primarily found in the central nervous system. There are a few other organs where there's in the body outside the central nervous system that have the CB1 receptors, but primarily in the central nervous system. Cannabinoid or CBD, cannabidiol, has CB2, cannabinol 2 receptors, and those receptors are not found in the central nervous system. That is why you do not get high with CBD, and you're able to purchase CBD over the counter. CB2 receptors are found in the GI tract, the immune system, in the smooth muscle, meaning the muscle tissue, as well as the adipose tissue, which is the fat cells. THC has or is associated with the psychoactive properties. CBD has no psychoactive properties. As I just stated, the reason why is the receptors. The receptors are not found in the central nervous system where the CB1 receptors are found in the central nervous system. So what is psychoactive properties? Psychoactive properties are the stoner's high, that slowed speech, paranoia, anxiety, the munchies, increased appetite, as well as sedation, right? Remember when you were a child and you went to a home party and you had the kids that were getting high, and next you know they're dipping in the chips and they got the munchies, and about a half hour later they're in the corner sleeping. Well, that's the effects of THC. You do not have that with CBD. Like I said, the receptors CB2 are not found in the central nervous system. So we're getting ready to go into the break. When we return, I'm going to describe the qualifying conditions, and then we'll address a few other things so I can, really get a full understanding of what I can do and how I can improve one's life. So come in and join my practice. Let me help you lead a happier and healthier life. You wait, it's too late. Remember that. You wait, it's too late. The key is to have a thorough history and physical, and we can address issues in the early phase. If it's the late phase, it's too late. We need to address it early if there's an issue. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York. Or give me a call at 631-980-8200. That's 631-980-8200. You wait, it's too late. Call now, schedule a history and physical, join my family. When you're my patient, you're my family. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. Today's topic, medical marijuana. I'd like to offer my listeners an opportunity to get a free copy of my second book on holistic healing. If you go to my website and you go to contact, Dr. O'Brien, click the button. And then what I'd like you to do is, this is a Kindle version. So if you have the Kindle, so you can get a free version. The first 20 listeners who email me through my website, and this is for Kindle, I need your just your first name, because I will write, and I'll give you a little note. So I'm going to personalize it, first name, and then your email address, and I'll send out, I will email you a downloadable Kindle version of Holistic Healing, my second certified #1 Amazon bestseller. So that's, again, the first 20 who email me, and this is a Kindle, so you have to have a Kindle, and I will send you a downloadable book. All right. Second, if you enjoy my shows and you missed previous shows, or you like to hear the shows and just repeat them. Sometimes people like to hear them a second or third time because I'm offering so much information. If you go to my website, drtommyo.com, on the top bar, just click Ask Dr. Tommy. Okay, Ask Dr. Tommy O, and then it will change page. You're going to see all my shows, and just click the show. You're going to see the title, and then click it, and you can listen. All right, so now back to medical marijuana. All right, so qualifying conditions. What are qualifying conditions? Well, the list of qualifying conditions are expanding, which makes it, really, really good for patients who really need care, especially for those individuals who exhausted traditional, medicine, traditional practice. My patients, they are not drug seekers. Okay, not drug seekers. They are very, very ill. When I first started out, it was the full scope of practice, and then I basically advanced into just mainly treating pain management. A lot of these patients, they're using narcotics, hardcore medications, morphine, Percocet, narcotics, and then you're concerned about the addiction and all the side effects associated with these medications. They don't want to be on it, okay? And I agree. It changes the chemical behavior, the biochemistry in your brain, and then your behavior changes. So I'm able to treat them, get them off those hardcore medications, and I'm able to put them on medical marijuana. And the cool thing about medical cannabis, medical marijuana, I'm giving you the necessary tools for you to manage your care. I'm not in control. You're in control. When you're taking prescribed medications like narcotics, you have to take it every 4 to 6 hours. With medical cannabis, it's whenever you need it. If you're not in discomfort, let's say you have chronic pain, you only use it when you're in pain. All right. So what are qualifying conditions? Well, as I just stated, chronic pain and neuropathy. Chronic pain and neuropathy. Well, neuropathy or neuropathic pain, it's chronic pain, but they separated that out. So chronic pain, neuropathy, cancer. Okay. We can treat cancer. Now I know traditional practice, they're going to frown upon that because you're talking that's $1 billion industry, but they do understand the medical cannabis can definitely treat the side effects associated with the traditional practices. With the traditional practice and the medications that they use because they're extremely toxic. Spinal cord injury. Neurological conditions such as Parkinson's, Huntington's, ALS, that's Lou Gehrig's disease, HIV, and HIV patients, they because of the medications, you're going to start seeing a neuropathy where they have damage to the nerves, and so they start to have chronic pain. They also have muscle wasting, weight loss, so able to treat them to reduce that pain as well as have them start to put more weight on and put them psychologically. They feel a lot better as well. So behavioral, and so we can lead a happier and healthier life. Irritable bowel disease, such as Crohn's and ulcerative colitis. I have a lot of patients, even IB. What's the difference between irritable bowel disease versus irritable bowel syndrome? What's called IBS. Well, IBS, you have this very similar or the same symptoms as IBD. The difference is IBS, they did not define what the condition is. And when I say they, I'm talking about the doctors or your GI doctor, because typically your primary care will start the workup and then refer you to a GI specialist. They're just not able to define it. They didn't see the tissue that's inflamed. So that's the difference. But we can treat them exactly the same with the cannabis. Then we have opioid dependence. As I just stated, a lot of patients were put on narcotics when they should have been put on a non-narcotic pain medication. And next, there's an addiction. The last would be post-traumatic stress disorder. So anyone that had trauma, I'm able to treat that, especially my military family. So if you're suffering post-traumatic disorder, please give my office a call. My patients do very well. I'm able to reduce the symptoms that are associated with post-traumatic. That's the anxiety, and anxiety will lead to depression. I want to make you, I want to stay emotionally stable. I want to reduce the anxiety. I want you to feel good about yourself. You're a hero. You're a champ. You made a difference. You protected us. You are my family. You are America's family. That's how we need to see you. So I'm here to care for you. So if you are military, you are my military family. Come in, post-traumatic. I will care for you. We'll set you up. We'll have you be in charge of your life again, rather than the post-traumatic and symptoms associated controlling you. So I only have about 3 more minutes, and there's a lot of material, but we're going to go into what we call delivery systems, and then we'll close out the show. So in New York, or actually in general, there are 4 delivery systems. The first is vapor or inhalation. The second is sublingual, or what we call tincture. The third is oral, and the fourth is a topical lotion. Topical lotions or the creams, they do patients who have rheumatoid arthritis or osteoarthritis, and you see the changes in their joints. They do extremely well with the cream. So onset and duration. Onset and duration. So for vapor, the onset, okay, what is a vapor? It could be an e-pen, and now the dispensaries are selling a joint. When I was a kid, it was called wacky tobacco, or some people called it the bud, the leaf, or the flower, or a cigarette. Onset and duration. Onset is 90 seconds, and the duration is 3 to 4 hours, but closer to the 3-hour mark. Sublingual drops, onset and duration. Onset is 20 minutes plus or minus 10. Duration is 3 to 4 hours, but closer to the 4-hour mark. Oral onset and duration. Onset is about an hour and a half plus or minus 30 minutes, and the duration is 4 to 6 hours. Now, what determines onset and duration? Whether or not you have food in your belly, because now you're going to have competition with digestion, absorption, and the liver must process this and release the metabolites. So there's no way for me to determine when this is going to happen. So I can give you a range. For the fourth, which would be the topical, again, about an hour and a half, and it lasts the onset about an hour, hour and a half, and the duration is going to be for 4 to 6 hours as well. We do have local dispensaries. We don't have that many because it's very expensive to get a license. But as we advance, you will see more and more dispensaries open up and offer their services. All right, so we're getting ready to wrap up the show here. I know it goes really fast. That's just the way it is. All right, so come in and join my practice. Let me help you and lead a happier and healthier life. You wait, it's too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Gap Paint Road, Suite 16. That's the garden level downstairs. East Patchogue, New York, or give me a call, 631-980-8200. That's 631-980-8200. Everyone, please be safe. Join my practice and become my family. God bless.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.